Hi, my name's Karen and I'm one of the midwives at my Expert Midwife. Today I want to talk to you about how you can protect your perineum during birth. Your perineum is an area of tissue between the vagina and the anus. That's your back passage, and it's also connected to your pelvic floor muscles. Around 85% of women will experience some kind of perineal trauma during childbirth, such as grazes, tearing or an episiotomy. That's a cut to the perineum. But there are ways to help you reduce the chances of this happening. Perineal massage during pregnancy is one, and we have a series of classes and videos on YouTube, Instagram and our website explaining and teaching this technique. Protecting your perineum during childbirth will help protect you afterwards in the long term, because you can have damage that can affect bladder and bowel control as well as your sex life. Perineal massage builds a foundation for reducing tearing and needing an episiotomy during childbirth. But what are the things to remember to help protect your perineum during birth? Well, one of the best things you can do is to avoid active pushing. Now, active pushing is also known as coached pushing, and this is when you might be told to hold your breath and bear down into your bottom. Now, if you're having a normal active labour and you're using active upright positions, you shouldn't need any of this coach pushing. Your body should tell you when to push. So you'll come to a stage where we call it as midwives, where you feel expulsive. So that's like you feel this automatic urge, and it's an involuntary pushing urge where your body pushes down automatically. So it's better to wait to feel that sensation. And if your midwife says you're fully dilated, sometimes there's a little period of time where you don't have to start pushing straight away. What you can do is you can just wait, wait for an hour, wait for 2 hours, wait until your baby's head has descended far enough down for that urge to hit you. It's also better to adopt positions that are going to kind of help you on your way a little bit with gravity. So gravity is your friend when you're in labour and about to give birth, because it's going to help that baby come down the birth canal. Now remember, your baby is coming through your pelvis, which is like a U-bend. So it's got to navigate this U-bend, and gravity will help it do that. So when you're thinking about positions, I think sometimes we feel as though women give birth on beds, which they often do on TV and in films and things. However, if you're having an active birth, you probably won't want to be anywhere near the bed. I'm not saying definitely, but most women, it's really uncomfortable for them. So think about the positions you could use. Standing up, plenty of women can give birth stood up, so long as they have the support to help them, or the support of their birth partner or the midwife or the bed. So standing up, kneeling, you can get down, have some padding on the floor and kneel, or you can get the back of the bed right up and kneel over the back of the bed. You can use a birthing ball, you can use a toilet, because that helps to open your pelvis almost 30% more than it would do if you were laid on the bed. And if you are on the bed, for instance, you might have had an epidural, for instance, so it wouldn't be a good idea to stand up because your legs won't give you the right support, then you could try a side lying position, which is also good for helping to protect your perineum as the baby's head is coming. So avoid lying on your back on the bed if you can. Listen to your body, because your body will tell you what is the most comfortable position, and it'll give you like cues and clues as to what your body feels is the best position for you to birth your baby. Now, as your baby starts to come and it's rounded that bend, so it's come around that U-bend, it does what we call crown. So it starts to stretch those perineal tissues, the ones that you would be stretching yourself if you were doing perineal massage, and it stretches them very, very slowly. So you might feel quite a lot of pressure, and it might start to sting a little and be a little bit burny down there, but it is for a really, really short amount of time. Now, what you could ask for when the crowning starts to happen is that your midwife puts a warm compress. Now, there's lots of research about this to say that this helps to stop the tissues from tearing there. So I've got a little demonstration here. So imagine that is your perineum there, and that is your baby's head. And as it's coming through and stretching it, it stretches it really quite thinly here. So what you want is, in every midwife's pack, she will have a swab, or you can bring your own flannel. And the swab, she will also have a bowl, which you can put warm water into. Dip the swab in there, and then the swab will just go gently onto your perineum there, and she will hold it there as your baby starts to come and to crown a little bit more. So also you need to listen to your body. You might want to put your hand down there yourself to feel the speed that your baby's head is coming, and to be able to control it a little bit more. But you also might want to listen to your midwife and have that communication going with her, and she'll be able to see what's going on if you don't have a mirror there to be able to look yourself, and she'll be able to talk you through breathing, when to push and when to do some maybe shorter, deeper breathing towards the end of that pushing. That will help your baby's head to come slowly and more easily, and to help the tissues stretch better. So, lots to think about there. It's time to get a bit creative and to take control, and to think about what you really want in your birth, and to put that down in your birth plan, even if your birth plan's just in your head. Okay, I hope that's given you some ideas.